Let's be honest for a second. If Nigeria's healthcare system were a person, it would be in the ICU. The diagnosis? It's pretty grim. But the real question is there a prescription? Is there a treatment that can actually bring it back from the brink? Well, that's what we're going to dive into. Let's diagnose this illness and see if we can find a cure.
And to really get a handle on just how severe this diagnosis is, we're not going to start with some dry statistic. We're going to start with a person. Just picture this. It's 2 o'clock in the morning, and Dr. Chioma is the only doctor on duty for more than 300 patients. She isn't just tired, she's facing an utterly impossible situation. And like so many others, she's already planning her way out.
And right there, that's where Dr. Chioma's personal struggle blows up into a national tragedy. Her burnout, her visa application, that isn't just one person's story. No, it's a powerful symptom of a system-wide sickness, one that's affecting over 200 million people.
So this brings us to the big questions, right? What is actually wrong here? What are the root causes of this failure? And probably the most important question of all, is there a cure? Can this actually be fixed? We're going to break it all down.
Okay, so let's start the diagnosis. And the first thing you notice, the most obvious wound, is that the system is literally bleeding out. It's losing its lifeblood, its doctors, its nurses. In Nigeria, they have a word for this phenomenon, Japa.
The word Japa from the Yoruba language literally means to flee. And you've got to understand, this isn't just about seeking a better job. This is about escaping. It's an exodus fueled by something people are calling professional heartbreak. I mean, can you imagine the pain of watching your patients die from things you know are preventable simply because the system around you has failed? The scale of this is just staggering. Over 9,000 doctors left the country in just a 6-year window. Now think about this. Nigeria only graduates about 3,000 to 4,000 new doctors each year. So do the math. The country is effectively running a training program for the healthcare systems of the UK, Canada, and the United States. It's a massive brain drain.
And the person who pays the price for that? The everyday patient. The ratio is about 1 doctor for every 5,000 people. The World Health Organization's recommended minimum is 1 to 600. So Nigeria would need to multiply its current number of doctors by more than 8 times just to meet that basic standard. This isn't just a gap, it's a chasm.
So why? Why are they leaving? Well, let's start with the most obvious reason, the money. A resident doctor in Nigeria might take home around $350 a month. Their counterpart, a junior doctor just starting out in the UK, earns nearly 10 times that amount. For so many, this is the difference between living on a poverty-level income and earning a professional wage.
But, it's not just about the salary. Not even close. Doctors are fleeing because of unsafe working conditions, including the very real risk of being kidnapped for ransom. They're completely burned out from working 80, sometimes 100-hour weeks. They're in hospitals where the power can cut out mid-surgery and where essential equipment is just broken. It's a total systemic breakdown that pushes its most valuable people right out the door.
So this mass exodus, this Japa syndrome, it's really a symptom. The disease itself goes much, much deeper. We're talking about decades of systemic neglect and underfunding from the very top.
You see, way back in 2001, Nigeria and other African nations signed something called the Abuja Declaration. They promised to allocate 15% of their annual budgets to health. The reality? They have rarely, if ever, even crossed the 5% mark. It was a promise made and has been consistently broken.
So what does that chronic underfunding actually look like for patients? Well, it means old equipment never gets replaced. It means hospital buildings are literally crumbling. It means basic, essential medicines are constantly out of stock. This isn't some abstract budget problem. It translates directly into human tragedy.
This quote from a pediatrician, it says it all, doesn't it? This is that professional heartbreak we talked about. It's the moral injury of knowing you have the skills to save a life, but the system itself denies you the tools to do it. Seriously, how can you ask anyone to stay in that kind of environment?
Okay, so we've diagnosed the sickness, and it's pretty bleak. But now let's talk about the prescription. Because even though the problems are deeply rooted, modern technology offers a really powerful, scalable lifeline to start the healing process.
I mean, just look at the contrast between the old way and what's now possible. The past is all about paper files that get lost, people taking long, sometimes dangerous journeys just to see a specialist, and a patient's history that's scattered across a dozen different places. The future? That's secure digital records, remote access to specialists through telemedicine, and a single, continuous story of a patient's health.
So how does this actually work in the real world?
It's surprisingly simple. A patient in a remote village can get expert advice from a top cardiologist in Lagos without ever leaving their local community. Telemedicine doesn't replace the doctors on the ground, but it acts as a force multiplier, extending the reach of the specialists who are still in the country.
And it goes even deeper than that. We're talking about things like Hospital Information Management Systems, or HIMS. Think of it as the digital backbone for a modern hospital. It connects everything from patient records to the pharmacy. This means fewer errors from trying to read messy handwriting. It means you can track your drug inventory so you don't run out. It frees up burned-out staff from endless paperwork so they can focus on patients. And maybe most importantly, it gives you reliable data to actually plan for the future.
But let's be real for a second. Technology isn't a silver bullet. It's not a magic wand. The full treatment plan has to involve rebuilding the system from the inside out, combining these modern tools with fundamental human-centered reforms.
And this is where we see how it all has to work together. You tackle the staff shortage not just with telemedicine, but you pair it with competitive pay that convinces doctors to actually stay. You fix fragmented care not just with digital records, but with a national health insurance system that actually works for everybody. You see, it's about a complete, integrated approach.
So we have the diagnosis, and we have a pretty detailed prescription. But the prognosis, the actual chance of recovery, that all depends on one final, crucial factor.
And this is the critical point. We have the roadmap, we have the tools, but a prescription is totally useless if the patient refuses to take the medicine. All of these brilliant ideas remain just that, ideas without implementation.
Because ultimately, the cure isn't a piece of software or a new policy paper. The cure is will. It is the sustained political will to finally meet that 15% funding pledge, to pay doctors a dignified wage, and to hold leaders accountable for the health of their citizens.
And that leaves us with this one final, powerful question. The choice is stark. Will Nigeria continue on this path, essentially subsidizing the healthcare systems of wealthy nations with its own best and brightest? Or will it make the deliberate, necessary choice to invest in a system that truly values its healers and, actually lets them heal their own people at home? The answer will determine the future of millions.